Hello everyone, and welcome to another episode of our debate series. Today, we tackle a question that sits at the very heart of medical ethics and patient care. Should doctors inform patients of a terminal diagnosis if the patient wishes not to know? We live in a world of diverse beliefs, cultures, and values, which makes this question not only ethically complex, but also deeply personal. Today, we'll explore how different cultures approach this issue, what it means for patient autonomy, and how healthcare providers can navigate this challenging terrain. Joining us are two exceptional experts. First, we have Dr. Marcus Fields, a bioethicist who has spent his career exploring the moral complexities of medical practice, and Dr. Vivian Rivera, an oncologist who has faced this dilemma firsthand in her practice. Our discussion today will not only illuminate the ethical considerations, but also delve into real-world scenarios and the cultural contexts that shape how we approach such delicate matters. Let's dive in. Dr. Fields, let's start with you. From an ethical standpoint, what are the main arguments for and against informing a patient of a terminal diagnosis, especially when the patient expresses a wish not to know?
Thank you. The ethical conflict here primarily revolves around two principles: autonomy and non-maleficence. Autonomy supports a patient's right to make informed decisions about their own body and life. However, when a patient explicitly states they do not want to know their diagnosis, we're faced with a paradox: respecting their autonomy by withholding information or ensuring they're fully informed to make other life-altering decisions. Non-maleficence, on the other hand, compels us to avoid causing harm. Some argue that withholding a terminal diagnosis could protect a patient from emotional distress or despair. But others contend that not knowing could lead to a lack of preparation, both psychologically and practically, which could ultimately cause more harm. This tension between doing no harm and respecting patient autonomy lies at the core of this dilemma.
A delicate balance indeed. Dr. Rivera, you've encountered this situation directly with your patients. Can you share your experiences and how you've navigated these challenges?
Certainly. One case that stands out involved a patient in his 70s, a beloved grandfather who had been diagnosed with a serious illness. Despite knowing that his condition was likely terminal, he made it clear to me that he didn't want to hear any specifics. His reasoning was simple but profound. He wanted to focus entirely on spending quality time with his family, not on worrying about how much time he had left. This patient was blessed with a strong support system, a loving wife, children, and grandchildren who were all there for him. He believed that knowing the details of his prognosis would only take away from the precious moments he had left with them. He wanted to live in the present, enjoying dinners, family gatherings, and the laughter of his grandchildren, without the shadow of a terminal diagnosis hanging over him. Respecting his wishes, I refrained from discussing the specifics of his prognosis. Instead, I collaborated with the palliative care team to ensure that his symptoms were managed effectively so that he could maintain a good quality of life. Our focus was on making sure he was comfortable and could continue to enjoy those special moments with his family, which he valued so deeply.
That's a powerful example, Dr. Rivera. But what about situations where the patient has no one to care for them, no one to take over responsibilities? How do you handle end-of-life care under those circumstances?
When a patient is alone, it becomes even more critical to involve a multidisciplinary team. We often rely on social workers, hospice care, and sometimes legal advisors to ensure the patient's wishes are honored while still providing the care they need. In cases like these, the healthcare team often becomes the patient's support system, guiding them gently and respectfully through their final days.
Now, let's broaden our perspective. Dr. Fields, how do cultural differences play into this ethical dilemma? How do practices vary around the world when it comes to disclosing terminal diagnoses? Cultural beliefs significantly influence how terminal diagnoses are handled. In Western cultures, particularly in the United States and Europe, there's a strong emphasis on patient autonomy and informed consent. Patients are generally expected to be fully informed about their condition, even if the news is grim. However, in many Asian cultures, the approach is different. For instance, in Japan and China, families often prefer to shield the patient from a terminal diagnosis, believing that the psychological burden could hasten their decline. The family may request that doctors communicate only with them, leaving the patient unaware of the full extent of their illness. In contrast, in countries like Mexico and other parts of Latin America, there's a blend of approaches. family-centric decision-making is common. And while patients might be informed, the family often plays a significant role in how much information is shared and how it's delivered. This is rooted in a cultural emphasis on protecting loved ones from emotional harm. It's fascinating how culture shapes medical ethics. Dr. Rivera, have you encountered cultural challenges in your practice, particularly with patients who might come from these diverse backgrounds?
Yes, cultural factors are always at play. I once had a patient from a traditional Chinese family who was in the late stages of cancer. The family was adamant that he shouldn't be told the full truth about his condition. They believed that telling him would cause him to lose hope, which, in their view, would only accelerate his decline. Respecting their wishes, I focused our conversations on managing his symptoms and ensuring he was comfortable, rather than discussing the prognosis. However, I also made sure the family was well informed, so they could prepare themselves and him for the inevitable, even if indirectly.
But what happens when a patient's wish not to know conflicts with their need for end-of-life planning? Dr. Fields, how do we navigate these situations ethically?
This is where the ethical waters become particularly murky. Ethically, we might consider a patient's need to plan for their death, making decisions about their estate, their final wishes, and saying goodbye to loved ones, as part of respecting their autonomy, even if they don't want to know they are dying. One approach is to engage in what's known as a limited disclosure, where the doctor provides enough information to encourage end-of-life planning without fully disclosing the terminal nature of the condition. This way, the patient can make necessary preparations without having to confront the reality head-on if they choose not to.
Dr. Rivera, have you employed such strategies in your practice?
Yes, I have. In cases where full disclosure might do more harm than good, I have used a limited disclosure to help guide patients toward making essential decisions. For example, I might suggest they consider getting their affairs in order or think about how they want to be cared for in the future, without explicitly stating that the end is near. This approach respects their wish not to know, while still ensuring they don't miss the opportunity to make crucial decisions. It's about balancing respect for their autonomy with the practical need to prepare for what's to come.
Let's introduce a hypothetical scenario, something that could happen in any practice. Imagine a patient who initially says they don't want to know if they have a terminal illness, but later their condition worsens, and they begin to suspect the truth. How would each of you approach this situation?
If a patient's condition deteriorates and they start to suspect the truth, it's important to reassess their wishes. I would gently bring up the subject, offering them the opportunity to reconsider their initial decision. It's common for patients to change their minds as they sense the end may be near. In such cases, they might want more information to prepare themselves and their loved ones, or to make peace with their situation. For example, I might say something like, "I've noticed some changes in your health recently. Would you like to talk more about what's happening?" This approach gives them control, while providing an opening for deeper discussion if they're ready.
This is where the concept of therapeutic privilege might come into play. Sometimes, withholding information is justified if disclosing it could cause serious harm to the patient's mental or emotional state. But when a patient begins to suspect the truth, it's essential to balance this privilege with respect for their evolving autonomy. In such situations, I would argue that it's ethical to revisit the conversation, providing the patient with as much or as little information as they are comfortable with at that moment. It's about being responsive to the patient's changing needs and wishes, which can be incredibly fluid in the face of terminal illness.
Let's complicate the scenario. Suppose the patient, after suspecting the truth, becomes anxious and asks directly, "Am I dying?" How would you respond, knowing they previously asked not to be told?
In such a delicate situation, I would prioritize honesty, tempered with compassion. I'd likely respond by asking, "What makes you ask that?" This question allows the patient to express their fears and concerns, and it gives me a sense of how much they really want to know. If they press further, I would gently confirm their suspicions, while focusing on reassurance, letting them know that, regardless of the timeline, our goal is to ensure they are comfortable and supported. The key is to provide the truth in a way that aligns with their emotional readiness to hear it. This is indeed a complex scenario. Ethically, when a patient directly asks about their prognosis, I believe we have an obligation to answer truthfully. However, the manner in which we do so is critical. The response should be framed in a way that aligns with the patient's emotional state and readiness, which can be gauged through careful, empathetic conversation. In such a situation, I would support providing an honest answer while immediately shifting the focus to what can be done to maximize their quality of life. It's about balancing truth-telling with maintaining hope, even in the face of a terminal diagnosis.
We've touched on cultural aspects earlier, but I'd like to delve deeper. How do cultural beliefs influence how these scenarios play out? For example, how might a patient from a culture that values family decision-making over individual autonomy respond differently to this situation?
Cultural beliefs play a significant role in how patients and their families approach terminal illness. In many Asian cultures, such as in Japan or South Korea, there's a strong preference for family-centric decision-making. In these cases, even if a patient suspects they are terminally ill, they might defer to their family to handle the details of the diagnosis and the decision-making process. In contrast, in many Western cultures, particularly in the United States and Northern Europe, there's a greater emphasis on individual autonomy. Patients are more likely to want to be fully informed about their diagnosis, even if it's bad news. This cultural difference requires healthcare providers to be attuned to the patient's background and to adapt their communication accordingly.
I've encountered this dynamic in my practice, particularly with patients from Latin American backgrounds. In these cultures, families often play a central role in healthcare decisions. I remember a patient whose family insisted on being the first to know any updates about his condition. They believed that shielding him from the worst of the news would help him maintain his spirits. In such cases, I try to respect the family's wishes, while also ensuring that the patient's needs are met. This can mean having separate conversations with the family and the patient, tailoring the information to what each party is ready to hear. It's a delicate balance, but one that is crucial for providing culturally competent care.
We've discussed the challenges and complexities of informing or not informing patients of a terminal diagnosis. But as we move towards wrapping up, let's talk about potential solutions. What strategies can healthcare providers use to navigate these difficult situations ethically and practically?
One key strategy is the implementation of advanced care planning. Encouraging patients to think about their preferences for information and decision-making early in their care journey can help ensure that their wishes are respected later on. This planning can include detailed conversations about how much they want to know and under what circumstances they might want to revisit these decisions. Additionally, training healthcare providers in cultural competence and communication skills is essential. These tools enable us to better understand our patients' values and preferences, allowing us to provide care that aligns with their individual needs while also respecting their cultural context.
I completely agree. Another important strategy is the use of multidisciplinary teams, including social workers, psychologists, and palliative care specialists. These professionals can provide additional support to both the patient and their family, helping to navigate the emotional and practical challenges that arise when a terminal diagnosis is involved. It's also vital to maintain flexibility. Patients' wishes can evolve as their condition progresses, so regularly revisiting these conversations and adapting care plans as needed is crucial. By doing so, we can ensure that we remain aligned with their current needs and desires.
What an insightful discussion today. We've explored the ethical, cultural, and practical complexities of whether doctors should inform patients of a terminal diagnosis if the patient wishes not to know. It's clear that there's no one-size-fits-all answer, but rather a need for a thoughtful, compassionate approach tailored to each patient's unique circumstances. To our audience, we'd love to hear your thoughts. Should doctors respect a patient's wish not to know their terminal diagnosis, or is full disclosure always necessary? Join the conversation in the comments, and don't forget to like, subscribe, and follow us for more in-depth discussions on the intersections of ethics and medicine. Remember, in the face of life's toughest questions, we find the strength to care deeply and think critically. Let's continue to explore these vital intersections together,